Good morning, everyone. My name again is Dr. Yakub, Wildlife Hospital, Abuja. Today, the series of our health talks, we'll be talking about one common ailment and that practically every Nigerian that has gone to a hospital has heard about. In fact, apart from malaria, it is the next common thing we hear about. So the disease or medical condition called typhoid is what we want to talk about. And the reason why we want to talk about it today is because we just want to make some clarifications concerning that disease, because in our experience we've seen that there is some sort of overdiagnosis of this condition leading to inappropriate use of antibiotics and the issue of antibiotic resistance every now and then. So basically we want to talk about typhoid fever and technically define what typhoid fever is and what do you feel when you have typhoid fever, and how do we make appropriate diagnosis of typhoid fever, and thereafter we'll talk about the treatment. Basically, typhoid fever is a fever that is caused by a bacteria called Salmonella Typhi, and Salmonella Typhi has different serotypes, but we will not go into that. Salmonella Typhi is a bacteria that is mainly found in humans. Humans are the only hosts of that bacteria, and it stays in what we call the intestinal tract, particularly in the gallbladder. So most people who carry this bacteria carry it in their gallbladder. Now, how is it spread? Usually it is fecal-oral. What that means basically is that we contract this disease by ingesting foods or water that is contaminated with fecal or feces of the persons who are carriers of this bacteria. Basically, the people who cook foods or make packaged waters and the rest of them, or even tap water that is contaminated. How does tap water get contaminated? If a tap is broken and the pipe passes through places where fecal or human feces is, of course, there is a possibility of the water getting contaminated with the bacteria. Then people who cook foods, if they have poor hand hygiene, entering the toilet, coming out, and then probably no proper hand washing, and then you handle food, that way the food can easily get contaminated with the bacteria. So basically, we get infection via contaminated foods and water. Now, when someone has typhoid fever, what exactly does he or she feel? Commonly, we see people coming into a hospital and making self-diagnosis of this condition. A lot of times people come and tell you, doctor, I have typhoid. I have had typhoid for several years. And then you'll be like, okay, what I commonly tell people is this: is if you have typhoid, the real typhoid fever that we know, not the Nigerian typhoid in quote, you won't walk up to me and tell me after. You'll probably be brought to me, brother, because it's actually a very serious medical condition. In medicine, we call it's a septicemic illness. It is a very devastating, debilitating medical condition that anyone who has it, with or without treatment, is toxically ill. So not the type of things that we see around. Someone has a headache, he'll tell you he has typhoid. Someone has abdominal pain or stomach pain, he tells you he has typhoid or he or she has typhoid, and all of that. That is not what it is. So essentially, what happens when someone contracts typhoid, there's a progression of the disease over a period of, so to say, about 3 to 4 weeks. And in these 3 to 4 weeks, usually the person gets progressively ill, sometimes without treatment. And almost always, it is at the end of the second or third week that the person now gets better with treatment. And if he or she will get complications, it is usually at that time the person that gets the complications and perhaps sometimes dies from the complications. So the first thing that happens usually is a fever. Fever is basically high body temperature. That's what we mean by fever. And classically, the fever or typhoid fever itself, or typhoid disease, it's so high that even in adults you see fevers or body temperatures above 39, 38, 40 degrees. And it does not come down at all until the fever or the disease is cured. If you have intermittent fever, that is, you have body temperature today or now, and in another 2-3 hours the temperature goes completely and you're well again and do your things, it can be typhoid fever. Okay, classically it's malaria that behaves like that, but we're not talking about malaria today. So typhoid fever, there is a classical description in medical textbook. We call it stepladder fever. It never really comes down to the baseline. In other words, so rather it is somewhere like 38 today, tomorrow it goes to 39, like that. So it keeps increasing until either the patient gets killed or the patient dies from complications. So it's a very serious thing. So the fever is one classical thing that we look out for in medicine to make diagnosis of it first. Then there are a couple of other symptoms. Yes, it may come with headaches, but headaches are never specific symptoms. It could come with abdominal pain. The abdominal pain might come from sometimes, with or without diarrhea or constipation. And then depending on the disease progression, sometimes people joint pains comes in, sometimes pneumonia comes in, depending on what exactly the spread of the typhoid is in the person who suffers from it at the time. Most of the symptoms, unfortunately, are not necessarily specific, and that is where the confusion comes in. Because when I started with fever, I said sometimes the fever is increasing, and a lot of times people confuse the fever with the malaria fever. That is the body temperature. Once somebody's body temperature is high, he tells, oh, I have malaria, I have fever, typhoid. Okay, so but fever itself is not necessarily very specific, but doctors who know what they're doing can easily tell the difference, especially between the fever of typhoid and perhaps fever of malaria, which is the next common thing we see, or which is the commonest things we see around. So the headaches, of course, headaches can come from every other thing. That's good. Body aches and pains can come from every other thing. Abdominal cramps can come from any other thing. So that's where it becomes a bit dicey for people to make diagnosis for. So you need someone who knows what is in to be able to put up these symptoms together. And then in addition to these symptoms, it is important that the doctor makes appropriate laboratory tests to be able to make a diagnosis of typhoid. The one common problem we see with the laboratory tests here is this. People go to the labs, they complain, I have fever, I have headache, I have this and that, and then the lab runs the test. The popular test, I'm sure if you mention it, that everybody knows, is a Widal Test. So they do a Widal Test, and based on the titers, you say diagnosis of typhoid fever, which is entirely wrong. That Widal Test was discovered by a physician somewhere in around 1890 something. That is more than 100 years ago. Now, most parts of the world, especially the developed world, has abandoned that Widal Test. That is because you cannot make specific diagnosis of typhoid fever based on the Widal Test. It's not allowed to. But what we see in Nigeria here is a lot of people go to labs, having self-diagnosed themselves with typhoid fever. The lab turns out a result that shows that 1 over something, 1 over 160, 1 over 360 is significant for typhoid fever, and therefore the person makes a diagnosis of typhoid. It is entirely wrong. Nowadays, the specific diagnosis of typhoid fever is made from cultures, and there are 3 body specimens that we are allowed to use, or we can use depending on the time you're seeing the patient. So if we're seeing the person in the first week of infection, supposing the person just present within the first week of having fever, usually it is from blood. You do a blood culture, you will identify the bacteria, and until and unless you identify the bacteria in the blood, no matter the fever, no matter the other complaints, that is not typhoid fever worrying the person. That is one. Now, if we see the person in the second week of infection, maybe second, usually the next thing that we're expected to do to make a diagnosis of the typhoid fever is do a stool culture. Stool culture, that is, we take the stool and culture it. If we identify the bacteria in the stool, then we say, now marry that with the symptoms that the patient complains of, then you say the patient has typhoid fever. But there's a caveat in this. There are people who are natural carriers of this condition. As I said before, when I started talking, I talked about people carrying the typhoid bacteria in their gallbladders. So every now and then, those who are carriers of these bacteria shed it in their stools. So the presence of the bacteria in the stool alone without symptoms or without other conditions associated with it does not also mean the person has typhoid fever. And so sometimes people have headaches. If you had a headache from malaria, for instance, and you're a carrier of typhoid bacteria in your gut, in your intestine, and you go and do a stool culture alone, the culture will come out with salmonella, but that does not translate to you having typhoid fever. So people need to understand this. So apart from stool culture, the other thing that we can do to make a diagnosis of typhoid fever, in addition to symptoms, is urine culture, usually by the 3rd week or thereabout. That's when urine can show the bacteria. So by the time you do your blood culture, stool culture, or urine culture, you should be able to identify the bacteria and marry that with the symptoms the patient had. Then you put it together and make a diagnosis of typhoid fever. Now please, we should take note of the fact that Widal reaction or Widal test does not diagnose typhoid fever, please, especially in the absence of other symptoms. Now, there are conditions that we must meet to make diagnosis of typhoid fever from Widal, and it is simply called a rising titer, rising serial titers, especially in addition to symptoms. What this means is that someone is complaining of headaches, abdominal pain, high fever, and I'm probably in a place where I don't have access to cultures. I cannot do cultures. And I can easily do Widal tests. So I'm allowed to take the blood of the patient, do the Widal titer, and then repeat it after 24 hours, another 24 hours. If I see that the titer is rising serially, that suggests that infection that the patient has is most likely due to, or maybe due to, typhoid fever or typhoid or salmonella bacteria. Otherwise, that is natural. Now, there's a problem again of this Widal test, especially in endemic areas. What that Widal test actually basically detect is not that Widal test detect the bacteria itself. It only detects the antibodies, or rather the chemicals that the body produces whenever the body is exposed to that bacteria. So if you're in an area where we have endemicity, that is like most third world countries, typhoid bacteria is all over the place, so we're almost always exposed to it. Now, because we're almost always exposed to it, our bodies constantly produce that chemical to fight it all the time. So the presence of the bacteria in you alone does not mean you have the disease, because the body fights it all the time. And so because your body is always fighting it, you're almost always having the antibodies in you. And so any day and any time they do Widal test, your reaction will be high. So that does not mean you have the disease. And this is the reason people have this experience. Every now and then you run a Widal test. As long as we are in endemic areas, your Widal titers will be high. But that does not translate to typhoid fever. The other situation that people should be aware of is the fact that malaria parasites cross-react usually with typhoid antibodies. So what that means is that sometimes they have malaria parasite and they do a Widal test. The Widal test will detect the malaria as Widal test because it will be high because of what we call cross-reactivity of the antigen antibodies of malaria. I think that is the reason why in most places you go around, for if you end up in places where they are not thorough in their clinical practice, you hear diagnosis commonly of malaria and typhoid, malaria and typhoid. It is actually wrong. It's simply because people do not pay attention to details, and it is wrong that we are exposing people or ourselves to inappropriate use of antibiotics. And therefore, at the end of the day, individually, collectively, when we continue this wrong diagnosis, wrong treatment approaches to this condition, we end up with a wide range of bacterial resistance. Not only that, we're also exposing ourselves unnecessarily to potential side effects of these antibiotics over a period of time. So therefore, our advice is this: when you have anything that you suspect as typhoid fever, please, it is not appropriate to walk up to just a pharmacy shop and take antibiotics. Don't walk up to a outside laboratory and do a Widal test and self-medicate. It will be appropriate that you go to the right persons, the doctors, and ask questions appropriately. Our aim here is to arm you with information that you can use to at least even ask questions from your caregivers, so that you will not be misled, or the doctors or you yourself, you will not self-medicate inappropriately. In summary, typhoid fever is not necessarily as common as we portray it to be in Nigeria. The reason it seems to be common is because of inappropriate diagnosis approach, and the use of Widal Test has actually made the diagnosis of typhoid fever so common, and it is wrong. So it is better to make the appropriate diagnosis, and therefore we get the appropriate treatment when it comes to typhoid fever. Thank you very much.